Hi everyone, I'm Pragalia. Welcome to our channel. With us, we have Dr. Julie Yeater with us. She's an amazing audiologist who's been in the field for the past 26 years, and she's done a lot of work with screening for infantile hearing loss. She's the UNHS coordinator of the largest birthing hospital in the Northwest Ohio region, and she's served on many state groups for the infant and pediatric hearing loss identification and detection and testing. She graduated from Miami with her Bachelor's of Science in Audiology and Speech Pathology, and with AT University with her audiology degree. She is a guest lecturer for University of Toledo and Bowling Green State University, and serves on a student interest group for the OSHLA. And she has helped initiate 2 cochlear implant programs in Northwest Ohio, seeing both adult and pediatric populations. Her specialty in audiology include electrophysiology and diagnostics, as well as cochlear implants. And with that being said, let's get into the video and the interview. Everyone, I'm Pragalia, founder and president of Here to Connect. And with me today, I have Dr. Julie Yeater.
Hi, I'm Julie.
My first question for you is, could you please tell us a bit about yourself and your background in audiology?
Yeah, so I'm an audiologist with Nationwide Children's in Ohio, and I'm in the Toledo office. So I work in a sort of a smaller clinic associated with the big clinic in Columbus. So I reside in Toledo, and my background has primarily been in the sector of diagnostics and pediatrics, specifically the infant hearing screening program. I was involved in that program for a while in a very large birthing hospital in Northwest Ohio. And I moved on to a different clinic in which I'm helping to start up the pediatric clinic in the Toledo area with Nationwide. And it's been a fun experience. My background, like I said, has primarily been with pediatrics, but I've also seen adults, but primarily diagnostics.
That's amazing. And could you tell us, is there anything that inspired you to become an audiologist, and how did your journey begin?
So I was always involved with music. So I started out playing the violin when I was in 5th grade. Like everyone gets the introductory opportunity to play instruments. So I chose the violin. And not too long after that, I decided that I wanted to play the cello. So I taught myself the cello. And interestingly enough, those 2 instruments are 2 different clefs when you read the music. And I really couldn't cross over to the bass clef that the cello was in. So I just sort of transposed everything as I went. But the cello was probably my main instrument into college. And I actually decided I didn't want to be in orchestra all the time. So I taught myself the French horn. So in high school, I played both the French horn and the cello in various modalities. So musicals, I also took private lessons and things like that. And then in college, I utilized music as my stress release. So I didn't want it to be my primary mode of study, but I was involved in some of the brass ensembles and the bands at Bowling Green State University and enjoyed that. I also took lessons for both French horn and cello and still maintained it as a hobby. So I think if I go to the root of all of this, music influenced my choice to go into audiology, not because I knew what audiology was, but when I was searching and trying to figure out what I wanted to do, even into college, because we all know we change our majors in the first year at least once, right?
Mm-hmm.
So it's pretty rare anymore to find someone who sticks with exactly what they decided at the ripe age of 18. So to make that decision for the rest of your life is impressive, really. So when I was exploring different opportunities while I was in college, this was intriguing, and I got into it, and it's heavily speech-based in the very beginning of your studies. And then my first audiology class, it clicked with me because the fundamentals of the physics of sound and music are the same, and the stringed instruments represent that physically. So for me, it was a very easy mode of learning and transitioning into understanding the components of audiology, sound and music and speech sounds and development and things like that. So it all kind of clicked for me. So it was one of those things. When I took my first class for audiology, I knew that was for me as opposed to going to the speech route.
It's really like interesting to think about how like the music can also like translate into like the field of audiology.
Yeah, I think that was a big influencer for me personally. You don't have to have a musical background, but certainly it makes it more, you relate to it a little bit in a different way, I think.
It's the most rewarding about audiology, or like anything that you wish people would knew about the job or profession.
I think the biggest take home for those looking into audiology, and obviously, in what you know about audiology is very different than what most people know about audiology, right? Because you've seen a side of audiology that not many people see.
Hmm.
So a lot of people think that audiology is just composed of people who do hearing tests and fit hearing aids all day long. And that's definitely not what we do.
Yeah.
So that's what some people do, and that's what some components of audiology are. However, cochlear implants are, a very small area of study in audiology, and so is diagnostics. Really, in diagnostics, I mean, like the neurophysiology component of audiology. So there's testing that I do that's my favorite. Some of the testing I do is called evoked potentials. And that's what we use on the infants or kids that are younger who can't give us a good accurate hearing test. That type of testing we use for them, but that's one of my favorite types of testing as opposed to just the sound booth. And then cochlear implants, obviously, I would take cochlear implants and those two, that other type of testing, hands down, I would do that all day long if that's what I could do. So it's a little bit different. My day is a varied day. I can see infants, I can see adults as well in my clinic. So the entire age range. I see a lot of kids in the 2 to 3 year old range. They're trying to figure out why they're not talking on time, or why they're not responding consistently in their environment. And so that's probably the majority of my day. I do see a fair amount of infants, so the babies who don't pass their infant hearing screening, I see them for testing as well. So I would say the take home is audiology is comprised of much more than what you think it is.
Hmm.
Yeah.
That's a lot of like different areas to work in within the audiology thing with the
Oh
part.
yeah, there's educational audiology, so there's audiologists who specialize in how you can learn best in your environment, what devices and what systems you need to do that. There's industrial audiology in respect to sound and hearing preservation. There's, like I said, diagnostic audiology where the testing component is your specialty. There's vestibular audiology, whereas balance, there's a lot of different balance tests you can do for within audiology. There's intraoperative monitoring audiologists. So they monitor with that similar type of test, they monitor during surgeries. So there's a lot of different niches for audiology that again, the mindset is we kind of just do hearing tests and hearing aids all day. And that's just for some of us, not all of us, but some of us, that's a very, very small component of what we do.
Hmm. For sure. Is there like any advancements lately in the field of like audiology, or is it pretty much like how it was?
Things are always changing, so it's very cyclical. Things are always changing. So every year there's new technology that comes out in respect to hearing aids. We have to stay up on the circuits of hearing aids that are coming out. And probably every year something's changing as far as hearing aids go. And remember, we use a multiple manufacturer. So there's never, I shouldn't say never, but typically you're using multiple manufacturers. Those manufacturers each come out with updates
Hmm.
in their circuits or their types of hearing aids available, and changing their technology a couple times a year. So if it's not software changes, it's circuit changes or style changes or something like that. So there's a lot of upkeep with staying current. The cochlear implant manufacturers, they usually come out with new processors about every 4 years. So their technology changes are a little bit different. They can still have software changes in between there. Testing wise, I would say testing probably doesn't change as fast as the manufacturer based devices do. Technology wise, there's always, it's kind of a double-edged sword, because you say, well, what's new? But how do I know what's new to me is not new to someone else? You know what I mean?
Yeah.
So it's all about staying current. And sometimes it seems like technology has changed, but it's just maybe I didn't know it. You know what I mean? I didn't know that. So I learned that. So therefore it's new to me. So it's a constantly evolving and constantly changing and updating and learning and staying new and fresh and open to new ideas, because I think sometimes you get new ideas from people, and just because I didn't do it that way before doesn't mean that I can't improve or make things more efficient. So it's a constant process of change. So I would say the most current change probably would be new. I mean, obviously the hearing aids, the new devices are always a topic of discussion.
Yeah.
Mhm.
Do you think there's any like certain skill set someone might need to have in order to become like an audiologist?
Um, I think the best skill set you could have is listening and being willing to help people, because that's the fundamental needs of this profession.
Mhm.
Um, I, everybody is in it for different reasons, I guess, and it you have to reflect on why you want to do this, because there's a lot of things that are done, say off the clock. There's things that are done off of patient time. There's things that are done that you think about outside of work sometimes. And that's okay. I always say I would rather put out a fire before it starts to be a fire.
Yeah.
So I like to know that even when I'm off, I'm always telling people, if there's a problem, I would rather know about it than to try to stifle it now than to have it blow up. And the same thing goes for patients. If there's problems, I would rather know about it and try to work through it before it becomes an emergency sort of scenario. So I think patience would be another part of it, is critical thinking and being able to look at a situation and go, okay, let's talk about this. Let's not escalate. Let's talk about it and try to figure out and troubleshoot this. So I think um, you have to go into audiology with the mindset that you're helping people along a journey. You're on the journey with them. And I've known you for a very long time, and it's the same sort of thing. You have to be willing to grow up with these patients sometimes too. And I think that's the best part of it. I'm fortunate in respect that I can see adults in addition to pediatrics, so I have that opportunity. So my pediatric patients who are now entering into adult phase, I don't have to stop seeing them, which I very much enjoy, very much. So I'm a part of someone's life who just they're expecting a baby, but I've known him since he was probably 7. So it's been a long time, and I've very much enjoyed seeing the type of adult and type of person he's become. So that's I appreciate that, and I'm honored to be a part of his journey, as yours.
Thank you. I'm honored to have you as my audiologist.
I think you'll forever be a part of my story, at least, little Praglia.
Remember like the mapping sessions and everything.
Oh yes, yes. I'd always think of 2-year-old little you walking in. We are getting ready to map your first side, and it wasn't the first mapping, but it was one of them. And you were like, "Nope, you're not touching that." You kept pointing to the other ear, and we're like, "You don't have an implant on that ear. There's nothing I can do with that ear." And you just would not. You were like, "No, I don't want you to touch this. I want you to touch this other one." So clearly, you were telling us from a very early age, "I want you to fix this side. This side's fine." So you knew what you wanted at a very early age, and that's what I love. I love that story.
Thank you. I know like talking about like the hearing journey and all that, I know it's like a really stressful thing for parents to like experience, especially since most people don't have like a history of like having people with hearing loss or deafness in the family. And for them to have like a child and not know like what's going on. Do you have any like advice to those families experiencing that?
um, I don't live that life, and I experience it through others. So I look at it as, together we kind of set up a plan with what works best for your family, and whether that's mode of communication or whether that's the devices that are or that the family wants to use. Those are all things that kind of come into play in the entire picture. And we also know that those percentages are the way they are. I mean, 90% of those with hearing loss are born to families that do not have a significant history of hearing loss. That's a large variety of people who don't have that experience, right? So everyone's journey is their own, just like they talk about pregnancy journeys. Everyone has their pregnancy story, same thing. And, everyone has their hearing journey and it's their own. And so my part in that is just to help kind of formulate a path that fits for the family. And I would say, always ask questions. I like it when people come with a list of questions to ask. I used to give out steno notebooks, just like those regular notebooks for families that if they have questions, write it down. Because I would rather, or email me in the middle of the night. I don't care. At least you got it off your mind. You know what I mean? And I can answer it when the time comes, but ask those questions, because when the families are interactive, we know that they're understanding what's being presented, and that's important. So
Yeah,
always ask questions.
definitely like a lot at first, but asking,
Yes.
yeah.
Yeah, for sure. And there's going to be a lot of appointments, a lot of different people to meet and whatnot. And again, our job is to help streamline that and make it understandable as to who you're meeting and why what it's for. Why are we doing this testing? Why are we doing that testing? Why are we doing testing again? And it's like, well, okay, this is why. So it's my job and our job as audiologists to inform the families of why we're doing what we're doing and what it means and how it's meaningful.
Yeah. My next question is, oh my God, sorry, I'm just like,
That's okay.
do you have any like good resources or some, okay. Do you have any resources you recommend to people who are deaf and hard of hearing?
Resources, a couple different things come to mind. It depends on the individual's age, obviously. It's always great to be bilingual. And for those families who want to incorporate ASL into their communication mode, I try to encourage that as much as I can. And knowing that this is probably going to be a bilingual situation rather than just one language being primary. And so it just helps facilitate communication within the family. So there's lots of programs within each state that offer ASL classes. You can take them through community colleges. There's a deaf resource center here in our area that offers classes. If a child has been diagnosed with hearing loss, the family can take ASL classes for free. There's lots of different opportunities for that, tons of internet exposure for learning ASL. So there's lots of opportunity for that. And as far as getting involved, each state also has what we call an EDDI program. It's the Early Hearing Loss Detection Program. And within that program, there's resources for the 0 to 3 crowd. So those young kids getting ready for school. Within school, you kind of transition to the educational audiologists and the team working in the educational system. And so there's lots of resources there. And again, it comes back to the same thing. Ask questions, because you'll have a clinical audiologist. You'll more than likely have an educational audiologist. If you don't have one, ask the principal for one. And get involved with the audiologists in the community associated with the child in how they're going through school. So there's lots of resources embedded already in sort of waiting to be used, sort of. Okay, so in each state is a little bit different in what they offer. There's always lots of programs out there in order to gain assistance or learn a new language, or whatever assistance may be needed.
And my final question is, do you have like any final comments or like advice for the viewers?
I would say audiology, as far as audiology goes, I very much love what I do, and I do it for the patients. I don't do it for the paycheck. I enjoy what I do. And I think that will be the best thing that leads you, is to lead into something that you want to do because you want to enjoy it. And I get a lot of satisfaction out of working with families and working with kids and working with adults too. And I think that's probably my favorite part of it is trying to figure out a new plan for the new family. And that's what I enjoy most. So in meeting people, obviously I've known you for a very long time. So it's meeting those families that you're not just in it for that one appointment. You could be in this for the journey of their life, which is very rewarding.
Yeah. Thank you so much for your time, Dr.
Yeah,
Julie. Such a pleasure.
of course. Yes. Well, thank you for inviting me. It's an honor to talk with you today.